I now have the privilege of introducing Contakt World. Contakt World offers a digital contact tracing platform for epidemic and pandemic response built for all contagions. It is focused primarily on health agencies and connecting B2B and B2I and local populations to them securely. Contakt World is using urgency of COVID-19 and billions in federal stimulus to place powerful tools in the hands of public health in perpetuity, while adding produced media to enhance adoption. Please welcome Justin Beck, CEO of Contakt World.
Thanks for your time everybody. So Contakt World is a privacy-preserving digital contact tracing platform. The problem with contact tracing today, and especially for COVID-19, is that it's not working. You have people or agencies spending literally hundreds of millions of dollars on something that isn't fast enough, it's extremely invasive, and our socioeconomic times right now is combined with trust and technology barriers make contact tracing a significant problem, especially for something that transmits asymptomatically. And then the digital solutions that exist today are unfortunately inaccessible by the most marginalized populations and the people that are dying from COVID-19 in specific. So we believe that in order for contact tracing to work, it has to be accessible by everyone, particularly the people with the highest risk of infection. What Contakt World does is it performs the 6 key functions as defined by the CDC. It does case ID, case investigation, basically helps health agencies find and manage cases of disease. Our proof of concept is demonstrated here through our alignments with public health. And when I say that, I mean we've already signed a deal to enter 50 states. We do expect to work with as many as, we have access to 3,000 counties and cities through NACHO. And then we have pending transactions that could give us access to as many as 150 countries through CDC Foundation and the Task Force for Global Health, leveraging at least $25 billion in federal stimulus funds to actually pay for our contracts. Interestingly, we were cited by as one of only 2 companies in the world to meet all of the initial criteria defined by CDC for contact tracing. This was not an accident. It's because we've been working with public health icons since inception. And we also believe that multinationals cannot credibly address this market because they can't credibly overcome the privacy concerns. So our MVP is ready. We're launching it here in Q4. It's built on the PathCheck Foundation from MIT solution, but we're adding to it several functions that make it easier for health agencies to reach marginalized populations. And as mentioned before, we have a way to not only engage with health agencies through our business model, but connect their businesses and institutions. So we believe that once we activate with a health agency, we have a very rapidly scaling business model. In only 6 months, we've filed 2 provisional patents with 2 pending. We've raised our seed capital. We've commenced a go public transaction. We've engaged one of the leading middle market M&A firms in the United States to conduct an aggressive M&A strategy. We've confirmed our market fit. And again, we've created our MVP, which is launching commercially this quarter. And we've definitely aligned with public health. So some of our co-founders include leading minds in public health. My co-founder, Robin Coleman, is the global health editor at Johns Hopkins University Press. Another co-founder, Daniel Dawes, is a national health equity leader, author of 150 Years of Obamacare, and the executive director of Satcher Health Leadership Institute. Our team has collectively engaged in over 500 plus M&A transactions. We've led companies with up to $1 billion plus annual P&L with multiple exits, and we've managed or led companies at every stage. And public health icons that were involved in influencing our system include public health mentor to Bill Gates, Dr. Bill Foege, former CDC director, as well as people involved in pandemic response for the last 3 decades. We also have, we'll touch on this again, but an iHeartRadio deal that's going to produce national media for us to help encourage adoption of our system. We're seeking up to $3 million here in the very short term through a 506c offering. And again, we're already in a going public transaction, and we're targeting a NASDAQ listing next year. A lot of people would say that's very fast to do these things. However, the market's moving so fast that this is our access to capital and opportunity to scale the company. Really appreciate everybody's time and look forward to hearing from you.